Good evening, good evening, good evening, and thank you for joining us here on blackdoctor.org. I am Ellis Dean, the Director of Digital Program and Production at Black Doctor, and I am really excited a little bit to talk about this this topic tonight. And I'm going to be completely honest. All right, so there were no three words that were, as a young Ellis Dean, would grate my nerves when my mother would say, "Brush your teeth." And I didn't know back then. I just know I didn't want to do it. I don't know why I didn't want to do it. I was in grade school, so calm down. So, but I was a grade school kid, and it was like I didn't want to do it. I don't know, for some reason I thought that gritty, nasty feeling in my mouth was better than that clean feeling. And it wasn't until as many men, I'm gonna speak for one behalf of men, as many of us realized, we started getting interested in other people having more romantic interests. Then we said, okay, wait a minute, I need to kind of worry about what's happening in my mouth area. And then you move forward in life. And then I got older and I recognized, okay, oral hygiene is essential. So particularly as a parent now, I really want my children to be focused on, okay, part of your whole activities of daily living, right? Those ADLs they tell you about, um, should be brushing and flossing your teeth. That is part of your routine in the morning and in the evening. So why that is, that's why we have these experts here to tell you about it, right? To tell you why it is. And then we got an expert here that says if you don't do that, you have to come see her, and that's not what you want to do. So the panel we have assembled for you. So a couple things I want to do before we get started talking to our panel of experts is number one, let us know where you're watching from. We'd like to know where people are watching us from all over the country, all over the world. So please drop that in the comment section. Number two, if you know somebody that needs this information, maybe a new parent, maybe somebody that's got some kids that's struggling with getting them to brush their teeth like my mother was, then tag them, share this on your page so they can get this valuable information. And then number three, if you have any questions throughout tonight's program, please drop those in the comments as well. We want to get all your questions, maybe not all of them, but we'll get as many as we can asked and answered on tonight's program. Good? All right, so hang on. First up, we have Dr. Alexis Russell. She is a dentist out of the New Orleans area. She's a board certified pediatric dentist. That means she knows how to work with your kids, and she did a little bit of extra learning to get to that pediatric dentistry. I know that I think it's 2 more years you have to do to get that pediatric certification. Is that right, Dr. Russell?
That's correct.
You have to do 2 more years. So your regular dentist is not as good as Dr. Russell. I'm just going to tell you that right now. So next up, we got Dr. Bristol Williams. She is a periodontist. Now, I don't know what that is, but I'm gonna find out. We're gonna find out tonight what it is and why. You might not want your child to go see them, but it's good to have that available if they need a periodontist. But let's work on. We can work on preventing versus having to see Dr. Williams. And then finally, is a face that is very. You should be familiar to right now. She has been on Black Doctor a few times before, and she just recently got a certificate, an award from HSS for her work with COVID and Little PPE. Our resident pediatrician is Dr. Samara Brown. Welcome to you all this evening.
How are you?
Thanks for having us.
So I forgot to tell you that Dr. Williams is also out of New Orleans. So they are taking time out of Mardi Gras to come and talk to y'all this evening.
This is more important. This is
very much so.
This is way more important. Your child's discount is way more important. So let's go with you, Dr. Wilson. When should parents start brushing their child's teeth?
You should start brushing as soon as the first tooth erupts. Oral health and good hygiene practices are started very early, right? It actually starts with the mother's oral health. If the mother doesn't have good oral health and good hygiene practices, then most likely that's not going to be transferred to the child. So as soon as that first tooth erupts, you want to start cleaning it for them, because sometimes they come out in multiples all at one time. You turn around and you're like, oh my God, they got a mouthful of teeth, right? But and contrary to popular belief, you want to start with fluoride, with a fluoridated toothpaste, not a training toothpaste. You want a fluoridated toothpaste, but at that age or at an infancy age, in an infancy age, you're going to want to use only a smear amount of fluoride on that toothbrush. Um, and sometimes it can be difficult to even brush an infant. So if you can't get a toothbrush in the mouth, then you can just use like a wet washcloth or like little 2x2 gauze, wet that up and just wipe the teeth with a little bit of a smear of that fluoride. But those are good practices to start in starting prevention early and developing those good oral hygiene habits early as well.
Now, are there some foods that parents should be avoiding to help bolster their child's oral hygiene?
You said avoiding?
Avoiding foods, like some foods. It's easier
Oh,
to say what you shouldn't be
right,
eating. We know what you should be eating. Good fruits and vegetables, like we know the good stuff, right?
right.
We know,
We
okay.
want a balanced diet.
Okay.
But so a lot of our children, once they start getting older and they can eat more solid foods, we're giving them a lot of like high carb snacks.
Mhm.
And so we want to decrease the frequency of high carb snacks, increase the frequency of water intake. And once children get to the age where, they're snacking a little bit more often, we want to kind of limit the amount of times our children are snacking to once or twice a day. And you want them to be seated when they're snacking as well, for the most part, because grazers are children that just like to pick up food, eat, and run off to the next thing, pick it up and eat, and run off to the next thing. Those kinds of children we call grazers, um, and they are shown to have higher frequency of cavities than a child that is seated eating a snack. But I always recommend that during a snack, um, we consume water, not juice, not a sugar sweetened beverage, or anything like that. So try to stay away from those high carb snacks like chips, cookies, crackers, because all of that breaks down into sugar.
So all the stuff parents typically give kids.
Yes.
Okay, don't do that
Those
anymore.
cheeses, goldfish, all of that. I'm not saying don't give it to them, but just give it to them in moderation. Everything in moderation, with some water. You
With
know,
some water. Dr. Brown,
with some water.
I saw you shaking your head on that as a pediatrician.
I was like, when it comes to the juice and the sugar sweetened, I always have to get a little line. And I mean, it definitely is, even as pediatricians, we really stress, right? There are other harmful things that are in juice, right? We know that sugar is very inflammatory to your body, right? So juice and sugar can be linked to your cancer risk, later in life. We don't recommend any juice, anything sugar sweetened under the age of 1, nothing sugar sweetened in terms of drinks under the age of 2, none, 0. In terms of 100% juice, we would say starting at 12 months, we would say the max amount that you want your child to have is 4 ounces. But that's the max, right? You really want to make sure that they're drinking water. They should be drinking mostly water starting at 12 months. And then also your choice of milk, right? When you choose whether it's an alternative milk like plant-based or it's, whole milk for cow's milk, you want it to be plain, right? Not the chocolate, not the strawberry, right? And even that has limits. And certainly those kids who are getting those bottles overnight or even breastfeeding overnight are also, going to be at risk for those cavities.
Yes,
So Dr.
absolutely. Yeah. I have something to add on
Sure.
with that, because on-demand breastfeeding after the age of 12 months, I mean, those children or children at that age, they have multiple teeth. And so a lot of times when that occurs, or they're being put to sleep with a nighttime bottle, um, it can cause baby bottle caries, or what is now termed a severe early childhood caries. And cavities is the most common chronic condition of childhood. And so we see it so often. So we're always playing catch up instead of, you know, um, preventing these occurrences before they happen. So it's important to establish these good practices early, so that we don't um, have to be running from behind, basically.
Right. So, you're bringing up a good point. Both of you are bringing up a good point because as a layperson, you say, okay, we keep hearing that breast milk and breastfeeding is the best thing for the child's health, right? But what I'm hearing is it could be harmful if it's done at the wrong time. Is that what we're saying, or is like help us kind of break down and stuff when breastfeeding could be harmful to the child's dental health?
Yeah, sometimes folks think that, breast milk can't be associated with cavities. So they're doing breast milk and water and nothing else. But breast milk has natural sugar in it, right? So if they're breastfeeding all through the night, and then they constantly have some source, right, on their teeth, just like babies who are getting bottles of formula or, bottles of milk overnight, it's going to increase that risk. So really, when they get to that age, and by the time the tooth first erupts, typically babies don't need to eat overnight at that age, and they've started to hopefully wean some of that overnight feeding. And if not, certainly we recommend some sleep training. But then making sure that after you breastfeed, that clean those teeth off, brush them off, to make sure that they don't have the breast milk or the formula, the milk, sitting on those teeth overnight.
Right. So, Dr. Russell, should we follow up breast milk with a little bit of water to kind of flush out the mouth?
Yes, I would definitely follow up anything. Anything you're putting in your mouth, you can follow up with water. Water constantly rinses the mouth. Um, and then, like Dr. Brown said, if you're at any time of day after breastfeeding or just a regular bottle feeding, wipe the teeth down if you have access to something that you can wipe it with.
So, Dr. Williams, I know we kind of left you out of this discussion, and I apologize for that. But I wanted to
Oh,
let's
no,
start
that's
with
fine.
let's start with what does a periodontist do?
So periodontists deal with bone, gums, and implants. That's it. So when we talk about things like what the ladies were saying earlier, you want to start these habits early because if these habits don't aren't taken care of or they aren't put into play, you see me in the future, and I'm the one that gives you that third set of teeth you got to pay for. So I'm the one that does the implant. So a lot of times these when it comes to these early childhood habits, I always get patients who tell me, when I was a kid, my parents didn't take us to the dentist, for whatever reason. And so now you're talking about working backwards. Most of the time I'm seeing people who have 13 teeth in total, but they want a full set of, they want a perfect smile.
Mhm.
So from just years of neglect, having cavities, having teeth taken out, not thinking that teeth need to be replaced. And so when people get to see me, that's a whole different conversation. So I always say, God gave you the first two sets for free. The third one you got to pay me for, and it's not cheap.
Go take care of them so you don't have to go there.
That's very true. I mean, because like and everything we talk about, because everyone who comes to my office, and again, I deal with. We'll talk about that later on about periodontal disease and exactly what that is. But most people that come to my office, it's the same thing. They're saying, "Well, I don't eat a lot of candy, so I shouldn't have cavities." I'm like, cavities don't come from candy; they come from sugars being broken down, or starches being broken down, the teeth becoming sugars, and it's things you leave on the teeth in those crevices that end up becoming cavities. But people don't know that they associate candy eating with cavities. So it's just a lot of things that people have to kind of unlearn. And I'm glad that we're in a form where people can do that.
I think you're making a great point in terms of just the some of the misconceptions that we have about dental care, dental hygiene. Um, so, Dr. Brown, what is that connection between our dental care, our dental hygiene, and our physical health, particularly in children?
Yeah, particularly in children, it's one of the most common things, that you're going to see in kids in terms of, caries. But then also sometimes you can start to see evidence of somebody who might have a genetic disease, right? In terms of how their teeth are coming in, how they're shaped, right? Sometimes they can have other, infections that get started as a carie, right? Sometimes teeth can carry things in them, right? So sometimes you can see that kids have been exposed to particular toxins, right? And then also, too, just in terms of heart health, certainly you want to make sure that if your child has a congenital heart disease or any heart conditions, A lot of times we need to do some prophylaxis too before you're going to get a dental cleaning. So that too is one of the common things that we see folks coming in because they need to get, cleared before they come in to get a procedure. And some folks don't realize that, there can be a risk to a dental cleaning for kids who have heart disease.
Mm, mm.
It's for adults as well. I have a lot of adults that come to me prior to cancer treatment, prior to having a lot of major surgeries. They have to get a periodontal clearance prior to getting any surgery done because if there's a chance that they have any infection in the mouth, which is what periodontal disease is, and it goes through the system, so it goes through your bloodstream. If you're going to be immunocompromised for, say, cancer treatment or chemotherapy, it can cause a serious problem. So a lot of people have to come see us before they're able to move forward with a lot of their medical treatment.
So talk to us more a little bit about that. Like you said, like an infection in the mouth can travel into the body.
Definitely.
How does that
Like,
work? Help.
there are many patients I can diagnose with diabetes before they've seen their physician from their oral exam. Because a lot of times they'll come to me, they'll have a lot of bleeding, a lot of swelling. What periodontal disease is basically everybody gets plaque on their teeth, right? You brush that plaque off. That's what we do with brushing. Some people who don't get plaque off in certain areas, it becomes hard and becomes tartar, what people call tartar calculus, right?
Okay.
Remember Ryan's and Ponderosa back in the day? With the
Yes.
growth phase?
Yes.
That's what that is for bacteria. That's what tartar is. Because
Okay.
if you get food stuck below the gum line, you get a lot of additional plaque on those tartar filled areas. Bacteria aggregate, they run through it. They're eating. Your body sends chemicals to kill the bacteria because it sees it as an infection, but what it sends to kill the bacteria kills the bone. So
Mm.
what ends up happening is when people say, when they go see their periodontist, their dentist, they say, oh, you got pockets, let me see you the periodontist. Whenever someone's probing and you're hearing people call numbers out, so your dentist should be probing you. If you
Right.
hear anything over a five, a 4 or 5, they usually send you to see a specialist because that means those are areas where you've lost bone. So where your gum level might be here, most people who are healthy, their bone level's right here. That's 1, 2, or 3.
Okay.
As you start to lose bone, your gum level stays high, but your bone level goes low. So you get food and debris stuck between your gums and where your bone are.
Okay.
My job as a periodontist is to get rid of that so you don't continue to lose bone. So that's what I'm a foundation person. So you
Okay.
can go get veneers, crowns, and all that fancy stuff, but if your foundation is jacked, you're still gonna end up seeing me. So that's why I tell people when it comes to bacteria, and back to what we were talking about before with the body, diabetics especially, your A1C levels, your blood sugar numbers are always super high when you have infection. Periodontal disease is an infection. Most of my patients who are having issues managing their diabetes, when we do just something as simple as a deep cleaning or a scaling and root planing is what it's called, can drive down their sugar numbers because we're getting rid of the infection. So that's why it's so important. Same thing with heart disease. The same plaques and the same bacteria that's in the bloodstream is known to is found in plaques that are on the heart as well. That's why you always want to get rid of that bacterial load. So that's the biggest issue. And that's that stink you smell come on people's breath when they got periodontal disease. It's
Okay.
all that bacteria emitting those gases, and that's why you need like me to go see your dentist. So yeah, that's where all that comes from too.
Wow, that was a word right there. I promise you, that was a word right there. You just learned about periodontal disease.
And one thing too, just to zero back on it, and I'm big on my father's a periodontist. I'm a periodontist. I'm just huge on gum and bone health because most people that come see me, because most of my population looks like me, which I love. That's the reason why I opened the practice. They always say, "Well, I'm not having any pain and it doesn't hurt." Periodontitis never really hurt. That's the issue. It gets to the point where you lose that bone, you don't know what's happening. And I've seen some people pull their teeth out,
Mm,
nothing on it. It's clean, just pull it out.
right.
That's how severe periodontal disease works. So that's why it's very serious. So
Okay. So no pain. Just as a recap. Doesn't have any pain, so don't wait for pain. That's a whole different level.
don't wait for pain.
Don't wait for pain. Understand diabetics need to be really concerned. Any medical conditions, really, if you are
Any,
cancer, heart disease, anything like that, you should be taking care of the mouth because really and that could have an impact on your quality of life, right? If you
Oh,
are,
definitely.
Absolutely.
if you're
And to
not,
tie it back to children and genetics, what Dr. Brown was saying before, and I see a lot of young black children because I do sometimes see children in my practice,
Mhm.
and they have what's called a lot of times, especially black women, girls, localized aggressive periodontitis. It's genetic. It's a infection that happens in the molars and the front teeth. So what ends up happening is these kids early on start showing severe bone loss in these areas. And so by the time they get to me, if it was undiagnosed by the, and that's why I say pediatric dentists are important because they're going to look for stuff like that. Most kids, general dentists are not going to look for that. And so by the time they come to me as an adult, it's throughout the whole mouth. So we're taking teeth out on people who are 21, 22 years old because there's no way we can save them. If we catch it early enough and young enough, we can, a lot of times we can treat it non-surgically. So that's one thing that we definitely have to start telling people to look for their children, especially young black girls. Because if a sister has it, the other sister probably has it as well. It's genetic.
wow, okay. Oh, so, parents, go take your child to a pediatric dentist.
Please.
I understand. I understand that general practice is good because you can take everybody in one car, but make the other trip, make the separate appointment. I know it's hard to get appointments. I used to consult with a pediatric dentist. It's hard to get appointments. It's hard to get appointments, but please do it. Take some time off work, get your child in there because they know their their craft, which is why they go to
Yes.
school for years of training. Dr.
Yes.
Russell, we've been
Yeah,
talking
just
we've been talking about Russia, but let's talk
talk
about
about Russian. Well, I wanted to say one thing in regards to what you guys were talking about the difference between a general dentist and a pediatric dentist. We do go to school for 2 extra years. So we have training in specifically the growth and development of children in their mouth. Medically compromised children. We know how to treat children in a hospital setting. There are things that we look for that a general dentist is not even. It's out their realm completely. They're not. They don't even know to look for it. I'm specifically trained in airway. I did my research in airway. So there have been children who have come into my office who I've referred to the ENT because I've seen signs and symptoms of sleep disorder disturbances and things like that. They're snoring at night, which increases their aptitude or their uh, likelihood of them having like sleep apnea because children can have sleep apnea,
right.
right? So I send them to the ENT, and then the parents are coming back and they're like, "Oh my God, they had to get their tonsils removed, their adenoids removed, all these types of things." But a lot of times we're the first person to see that because we're trained to look for those things. We are not just physicians or dentists, right? We're physicians in the mouth, and we're trained to look at all of these things because our children or your children are our first priority. Their overall health is our first priority.
Right.
Um, so that's just super important.
You know, the office that I used to consult with, the pediatric dentist there was a specialist in osteogenesis imperfecta. Is that brittle
Hmm.
bone disease?
Hmm.
And we realized that how much that impacts your teeth as well. Your teeth can
Yep.
become brittle, just like your bones do. And so
Yep.
therefore, people were flying in from all over the country to see her because she could help rebuild their mouth. And they had to do it periodically because as the child continued to grow, you had to redo it and it had to be redone. And it was a really fascinating procedure. But to have a pediatric dentist that could do that, not realizing the lives that she was changing and, saving as a result of that. So just
Hmm.
kudos to pediatric dentists, and continue. Again, I understand that person Shingle says general family practice. If you got children, go to a pediatric dentist. So Dr. Russell, we've been talking about brushing, right?
Hmm.
Dr. Williams has really scared us into into brushing. Talking about you gonna lose some bone. It's.
Better
But
bring that platinum card. You come to see me.
Oh,
so, and please, and just as an aside, please, when you get that referral, if you get that referral to go see a peridontist from your dentist, don't ignore it. Because
please don't.
y'all know y'all supposed to be putting them
It's just
referrals.
gonna get worse.
They bring them to me from 2 years ago. I'll be looking at them like, come on, you got this 2 years ago. Cut up.
We already told y'all you're not gonna have no pain. Like so, you look. just go take your card now. Okay?
Right. Take
Take
it,
your
bring it
card.
with you. Bring two.
You know what I'm saying? Get your GoFundMe, whatever you need to do, get it
Mhm.
together. But please, please follow up on that referral because she's not referring to you. Dr. Russell's not referring you to see Dr. Williams just on the whim. Oh, I need to get my girl some money. I'm gonna break her some bread. I'm gonna see. No, no,
Right.
no, no. It's real and it's real serious when you see Dr. Williams. So make sure you follow up on those referrals. Trust your dentist when they say, "Hey, I'm going to refer you out
Yeah.
to a period
And a lot of times, though, it's fear. You
Yeah.
know, why they're not showing up. It's fear of the unknown. They don't know what they're getting into, or what is it? Like you said, what is a periodontist? It's that sounds serious, right? But that's the thing. It is serious. Like you're getting the referral for a reason. So follow up on those things because your health is important. We
Right.
have to prioritize health.
Yeah.
So
Right.
Hmm.
Right. So, Dr. Russell, talk to us about flossing. Why is flossing important as part of your hygiene routine? I know a lot of us are really kind of focused. We've been focused on brushing, and
mhm.
brushing is good, but why should they be paired together? And how important is flossing in terms of overall hygiene health?
Okay, well, brushing is just going to clean the surfaces of the teeth that you can see, right? So flossing is important because your teeth have contact. So the teeth are sitting right next to each other. And so if you're brushing, you're just getting this outer surface and this top surface and the backside, right? So please make sure you're brushing all sides of the teeth. But when it's contacted like this, the floss is going to get in between the teeth. So it's going to get all the stuff that you can't see. And like Dr. Williams was saying, when that stuff gets in there, gets stuck in there, it gets stuck in there. And especially popcorn. Popcorn, those popcorn husks, like, oh, Lord, they cause so many issues. But we
You
know
know,
kids
black folks love the
popcorn
popcorn.
husks.
I do too. I'm black folks. I'm
We like
black folks. I'm black
we
folks.
love
We
the
love
popcorn.
a little popcorn.
Ooh, that dang popcorn. But
I
those
was gonna pop some
it's
tonight.
stuck, it gets stuck. And you can't get it out unless you're flossing it. Right? And if you think about it, when food gets stuck in between the teeth, it's almost like a piece of meat just sitting on the counter, right? If you're not
Mm,
getting rid of it and it's just sitting up there for days and days and days, what does it do? It rots,
Yeah.
right.
right? So that's what it's going to do in your mouth if you're not cleaning that.
And
Now,
I
for
let me make a point too. I'm sorry. When you do
Mhm.
floss, because people coming for oral hygiene instructions, when you pop that floss down, don't pop it back up between your teeth. Pull it out. So when you go down between your teeth, you pull it, and then when you rinse with the water or Listerine, that's when you bring the debris out because y'all will pop it back, pop that food right in between your teeth and get cavities in between your teeth. Just saying.
No comment.
That's why I hate those U-shaped flossers that everybody tells me they use. When they clean their teeth, they have the worst invention. Because when they pop it right back up. I know you got some. You got some right behind you. Uh-uh.
We were talking to Dr. Russell. I'm about to turn put
I'm
Dr.
sorry.
Williams.
You're right.
I'm gonna put you
Turn
on
my mic
mute right
off.
now. I'm about to put you on mute. You're gonna be on time about Dr. Williams for real. Okay. We're talking to Dr. Brown and Dr.
I
Russell.
apologize. I'm sorry.
Ooh, you hurt my feelings today. Please stop. Okay. Dr. Russell, you was telling me about flossing. Thank you.
Listen, it's important. That's it. But please make that a part of your routine. Make it a part of your child's routine,
Woo.
especially if the your child's teeth are very close together or crowded.
Mhm.
Um, you got to get some floss between those teeth to get that food out, or
And
else you're
Dr.
gonna have
Russell, what age do you
organ issues.
suggest flossing?
Well, it depends on the anatomy of the child because if the child has spaces between their teeth, then you don't necessarily need to floss. Um, but I do still recommend it because you're trying to make it a part of the routine,
Okay.
right? So introducing floss early will allow the child to become more comfortable with it because flossing can be somewhat uncomfortable, right? If you're not well versed in it, if you don't know how to use it properly. So allowing the child to have some autonomy and I just recommend like those little floss picks with the little picks that have the little floss on the end of it for children.
Yeah.
Um, because the child can hold on to it and try to put it in between their teeth as well. But I always recommend that an adult, um, come up behind the child and floss behind their child and brush behind their child up until about age 7 or 8.
Mhm.
Okay. So now I got to go throw away them bags of pigs. Okay. All right. It's okay. All right. Thank you, Dr. Williams. That's why we have you on these programs. That's why we have you here. That's why we gotta learn the right way to do it.
I'm used to being the bearer of bad news. I knew what I was.
You can use them on your child, though.
I just wait to $10. It's all good. It's all good. Okay. It's okay. I'll go back to the wrapping my fingers.
But I mean, I've learned so much from these two, you know, and I think it's so crucial because I think a lot of parents don't realize that they need to continue to brush their child's teeth all the way up to that age. I mean, really until they have the dexterity, I think they say writing cursive, which kids don't even learn anymore, right? You know, they really need somebody to get in there, you know, after them, and that, you know, 2 minutes. And as Dr. Williams teaches me about that soft, nothing other than a soft toothbrush.
Oh, please,
Yes,
please. That's a whole other conversation.
That's a whole conversation, right? Okay.
So I tell everybody, medium and hard brushes are for you to clean tennis shoes. That's it. Soft and extra soft is all you need. Because if not, then you got to see me to replace that tissue. That's a whole other conversation.
Okay. I gotta listen.
And this right here is not brushing. Like,
okay, since you have been the bearer of bad news, Dr. Williams, let's just go ahead. Can I be using my electric toothbrush? Is that okay?
Let me ask you a question.
I got the one that spins.
Let me ask you a question, because this is my pet peeve. When you use your electric toothbrush, do you still do this motion with it?
I do a circular motion.
Why? The whole purpose of the electric brush is to do the work for you. You just got to put it on the teeth and it goes. You don't have to move it. I see people doing that all the time, and it blows my mind. The whole technology behind the brush is the vibration of it or the movement in order to get the plaque off the teeth. So all you have to do is either turn it up towards the gum line so it can do its job to get the plaque, sweep the plaque from under the gum line. But y'all be doing this. And I'm like, y'all might as well have a manual brush and save that $300. But all jokes aside, one of the very good things about the newer brushes is that they are pressure sensitive. And a lot of people, even though they do have electric brushes, they do still do this. They do this very hard. If you continue to do that over time, you're going to brush away your gum tissue, and then bone follows tissue. So then you get recession. So your canines start looking long, right? Because that's where your mouth curves. That's where the bone is the thinnest. So then all of a sudden you start having sensitivity because your root is exposed. That's why I'm always pressing that people need to use soft brushes or extra soft, because if not, you can end up brushing your gum tissue away, and then we have to see me for things like a tissue graft. So I'm trying to avoid, trying to get you all to deter you guys from coming to see me, but when it's time, it's time. But I don't think it's the biggest thing.
I don't want to see you, Dr. Williams. I might get treated, but I'm gonna get cussed out while I'm getting treated. So
now, my question for Dr. Russell too is, what age do you think to put kids on electric brushes? I know they have a lot of kid brushes that are electric.
Well, I have recommended as young as like 3 or 4, as long as they can handle the vibration of it, because some children have sensory issues and things like that. But if they're okay with that, and as a parent, you can introduce an electric toothbrush like on the hand, right? So that they get used to, or they know what to expect, because a lot of things can be startling for children if they're not used to it. So, but it's as early as they can tolerate it.
So if they're flossing and their gums start bleeding, what is that a sign?
That's a sign that you got where you need to get. Okay, don't let the bleeding be the deterrent, because bleeding, that's what it's supposed to happen. It's supposed to get it all out, so that as you go back time and time again, it's going to stop bleeding. But you have to be consistent with it in order for it to stop bleeding. I know it sounds backwards, but
100% correct.
If it's bleeding, keep doing it.
Because healthy gums don't bleed.
Right.
Yeah.
Dr. Work gonna tell it to you. So yes, so parents and people in general, we talk to adults too. if you are flossing and your gums start bleeding, that is not a sign to stop flossing. That is a sign you need to floss more because you've been damaging there's something that's damaging and causing that sensitivity in your gum, and you need to floss more to get that out of it so it'll stop. The bleeding will subside over time, but you've got to get in there and floss and make that part of your routine. Not the little pig flosses like Dr. Williams told you. Get the string, wrap up, pull it out. Don't go up and down. You just rub it. You just rub it. Like you get a stain on your clothes. You don't rub it because then you go rub it all over. Up, out. All right. So plan at least, and you're supposed to brush for like 2 minutes, right? Right when you're brushing, that's 2 minutes. And then flossing with full set of adult teeth or children's teeth, that could be. So you just plan 5 to 10 minutes for your oral hygiene every day, right? And that's twice a day, morning at night, and then really, suggested also you should brush after meals sometimes too.
Mm-hmm. Well, yeah, like I say, you want to, but mostly morning and at night. And also for adult patients, to me, water picks are the best thing going.
Okay.
So people don't want to use them, but it's a little bit of a cost, but water picks work wonderfully. Just don't put it on 15, put it on 5. Everybody wants to crank it all the way up. That's not necessary. And you can buy one water pick for the family, just buy different heads for the part that goes on the attachment. And I always tell people if you do have a water pick, mix in a cap of Listerine and just a cap of peroxide. It really works wonders to get any additional debris from below that gum line and kind of keep those areas clean.
So Dr. Brown, parent has a new child, they have a new baby, they're coming to see you for their healthy checkup, right? They got to come get their vaccines. There's probably like 15 or 16, I believe, vaccines that children get in the first 5 years of life. When do you have that conversation about going to see a pediatric dentist as part of them coming to see you?
Yeah, we really do start talking about it early. Some babies do get their first tooth as early as 4 months, right? So you really want to talk about it early because you want them to know that oftentimes it's going to happen in between the visits. So you want them to know as soon as that tooth comes in, that's when you need to start brushing. And you also want to talk about their water source as well, right? So that too is crucial, right? Do they have well water, right? Do they have city water? Because well water sometimes has no fluoride in it. Sometimes it has some, sometimes it has too much, right? And then who's checking that well water? It definitely needs to be checked at least once a year. So definitely when we're talking about how you're feeding your baby, we're also going to go into that, right? Are you still using your bottles, right? Are you still using those passies, right? Are you cleaning the passy off with your mouth and then putting it into your child and introducing your own bacteria to your child, right? So all of those kinds of things we're really going to talk about at the very beginning just to really set them up. And I think one of the biggest pieces too is that then when that first tooth comes in, and we're talking about seeing a pediatric dentist, right? So sometimes they want to know if I can check those teeth and sign off, right? But they really need to see the pediatric dentist, right? And then be prepared to have fluoride applied because some parents think that it's dangerous to have the fluoride applied with the dentist when they go. Or they go and call someone and they say, oh, kids don't need to be seen until they're 3 or they're 4 years old, right? So a lot of times, we see this, or they haven't added, dental health onto their insurance plan yet because they didn't think that their child was going to need to see the dentist, right? But it's just as important as coming to see me. It is the number one preventable disease in children. 23% of kids 2 to 5 already have a cavity. Over 50% 6 and up. Over 50% of kids have cavities, and it's completely preventable. So, it's also a disparity. We know that folks who are, look just like us, right? We get not the best advice sometimes, not the best care sometimes. So this is why we're here, with you, Ellis, to really let folks know how important this is, that it's preventable. And, if someone is telling you your child doesn't need to see a dentist till they're 3 or 4, that's just absolutely wrong.
I'm gonna call Dr. Williams on. I'm call Dr. Williams on him. Like Dr. Williams said, I'm not supposed to take my kids to I just up had to fold and walk away. Just like,
Right.
Yeah.
You're right.
A dental home should be established by the time the first tooth erupts or latest by the child's first birthday. So you can use that as a marker.
Yeah.
Your child should have seen a dentist by the first birthday or have an appointment set up around the first birthday. That's a good marker, right there because it's important to establish that dental home early so we can have conversations like this. A lot of anticipatory guidance. We talking about what you should be doing at home, what you shouldn't be doing at home, what to look out for, trauma. And we know kids are learning how to walk. They fall into things, they get hit in the mouth, they run into the wall, they hit the floor. So trauma is important as well. We talk about how much fluoride should be applied to the teeth or used utilized in toothpaste. Like Dr. Brown said, what other fluoride or what other sources of fluoride is a child getting? Like the water, tap water, well water, bottled water. There's a lot of conversation that's had.
And one thing I want to add to that too about the importance again of a pediatric dentist is because I see so many adults who are just completely fearful of a dentist. And
mm,
that's usually something that happened in their childhood. When I was in my residency for perio training, I was a general dentist at night. And I remember walking into a room and a woman told her child, "Well, I mean, because if you keep cutting up, I'm bringing you back to the dentist like I'm the horrible person." And so this child was fearful coming back because she saw coming to the dentist as a sign of punishment.
right.
What I find in a lot of pediatric offices is that they work so well with children, they never really get that fear. Either they can put kids to sleep who need to be put to sleep, but it takes away a lot of that trauma that these kids end up internalizing, and they come to see me as an adult. They're frightened because they've had so many problems as a child.
So let's talk about trauma to the mouth, right? And so how is that treated? I've heard, so I'm gonna put a wives' tale out there and see if this works. Okay, if your tooth is broken or chipped, you can put it in milk and it can be potentially salvaged.
All right, let me address that.
Okay, I've been wrong a lot. Dr. Williams is
No,
maybe
I
out
mean
there my life right now.
No, no.
that's kind of along the correct lines, but that
Okay,
is if you have lost like a permanent tooth and it's completely avulsed, meaning the entire tooth has come out. Not if it was just a piece fractured or things like that. But what happens is that's a good transport medium um, until you're able to see the dentist. But we really don't even want to get there because as soon as the tooth completely comes out, you want to put it right back in. Okay, you don't want to wait to reimplant a tooth. And this is just for permanent teeth, adult teeth. We're not talking about baby teeth at all because if a baby tooth comes out, you're not reimplanting it at all. You're not putting it back in the mouth. Just let it be and
right.
call your dentist to see if you need to bring your baby in to take a look at that trauma to see if there's any other treatment that is needed at that time. But for an adult tooth, when a tooth comes out completely, reimplant it immediately because that increases the prognosis or the good prognosis of actually saving the tooth. Um, and then get to the dentist right away because there's some other stuff there, stabilization things that we would need
Mhm.
to do in
I
order
had
to
a case
hold
like
that
this.
tooth in place. hmm And then there's going to be a series of follow-up appointments, right? So we want to make sure that is very important. It's like you got to come, we're going to check it out originally, and then you have to make sure you come to those follow-up appointments if we want to save this tooth in the best way possible.
I had a case this week with a young guy who was he had a very fun weekend and he knocked out his entire front number nine front anterior tooth. And
hmm
so he went to the emergency room and they placed it back in there crooked.
See?
Mm,
So the front tooth was longer than the other tooth. Thank
hmm
the Lord that he had brackets on his teeth and no wires. So what I did was I was able to open the gums up, kind of clean out all the tissue that takes when you lose bone tissue always takes place of bone. So if you have any trauma, it's always soft tissue. So I had to clean that out. We were able to push it back in the same position, wire it. And like she said, it's a series of visits. That's no guarantee you can keep it. This we did what we could because
Right.
we were about 3 days out. But this was last week. But yeah, trauma is a real thing.
Hmm.
All right.
And it's very common in the adolescent age group because they're playing a lot of sport, baseball, basketball, and you're getting knocked in the mouth. So that's why a mouth guard is very important if your child is playing sports.
Yes.
So you can
They
just
try to
get it
make them
over the counter at Walgreens, Walmart, Amazon, and just
cool.
do like a boil and bite mouth guard just to try to help protect those teeth as much as possible.
They're making them cooler now. I think some of the kids are starting to, they make them all kind of colors and got little sayings on them and all that kind
Hmm.
of thing. So
Hmm.
they're trying to make them more appealing to, especially young adults that are sports playing. If that are still can see a pediatric dentist, but think they're too cool for that. That teenage, adolescent range. Um, yeah, adults need to be wearing mouth guards as well when we're playing sports or engaging in high risk activities. Even like if you're mountain biking, you might want to do that because you could take a hard tumble and that could be problematic. So there's a lot of times when you should be wearing mouth guards, but you're cool to get your teeth knocked out, right? So that's really the way you should go. And yeah, it doesn't look cool all the time when you got to put the mouth guard in, but your teeth and you will thank yourself if you get that elbow in your mouth.
They need them for Mardi Gras parades because
Yeah, they
I'm
do.
so busy. No, seriously, I'm so busy the week after because people get hit in the face with beads and
Hmm.
they get their teeth knocked out.
Oh
And
wow.
so the week after Mardi Gras, a few days after Mardi Gras in New Orleans, I'm packed with
Okay.
people with trauma.
I see. So we've got a question from Tina, watching out of Ohio. So shout out to Tina. I'm gonna put it on screen here. Is oregano oil mixed with toothpaste good for your gums?
Tina, no, stop. Y'all got to stop it. Because I'm tell you why. And this is my soapbox because I get a lot of us, and I like again, all my patients look like me, and it's always all these natural things we want to add, especially when it comes to gum health. The biggest thing is just the usual brush, floss, I say water pick, and rinse. That's what is going to be necessary. I hear a lot about coconut pulling and things like that, and all that ends with is just you coming to see me a lot slower than you need to. I had a young girl a couple of weeks ago that her mom had her doing coconut pulling at the age of 18. She's now 21. We have to take out 6 teeth on her.
Mm,
So I tell people, go to your dentist. I understand people want to mix their toothpaste with things. As long as you're sticking with the brushing, flossing, either water pick or rinsing, that's really what you need. And definitely going to see your dentist every 6 months and making sure they check your gums periodically so they probe you to see where your numbers are and where your bone levels are. That's the biggest thing.
we got a really good question here from Patricia who's watching. Basically, what's the best way to choose a dentist, a pediatric dentist for your child because she had some a bad issue with her daughter, so now she's dealing with a grandchild, and she's like, okay, what's the best way to pick a pediatric dentist so she won't have the same issue that she had
I mean, I would talk to family and friends and get recommendations that way. You can also go to American Academy of Pediatric Dentistry website and look for pediatric dentists in your area. Um, Also, every pediatric dentist isn't board certified. So if you're looking for that that extra knowledge or that extra certification, then you can go to the American Board of Pediatric Dentistry and and type in your area and be able to see who are board certified pediatric dentists in your area. After that, I'll probably do like reviews, go Google reviews based upon what you see or who you locate.
Okay. All right, great. So she said, thank you for, for
Hmm.
asking, answering the question. Great.
I'm also going to add on to that.
Mhm.
And when you do find a dentist that you do think that you like, see how they treat you in their office. That's very important
Okay.
because I get a lot of cases from people who have been treated a certain way when they go to certain offices. For instance, people may treat them from the door. They may take a quick look at them and then may say, well, you're going to need this, this, and this from the
Mm,
door, as opposed to really getting in there and wanting, making you feel as though you're comfortable in a space. Make sure your comfortability is, if it's, to me, it's important. Make sure you go somewhere where you feel comfortable and you're able to ask the questions you feel like you need to ask. Because some people make you feel that you shouldn't. And I'm just going to leave that right there.
And I definitely get a lot of families who say sometimes they go to somebody where they're not actually allowed to come back. So I was going to ask Dr. Russell, what do you advise parents in terms of who can be there when you're doing the cleaning? How do you warm kids up? Just so families have an idea of also to the style to look for.
You want to go wherever you're comfortable and wherever your child, feels comfortable. Um, when it comes to parents in the back, as long as the parents aren't disruptive and the dentist can have the full attention of the child, I think that's very important because you're trying to establish a rapport with your patient, and it's hard to do that when parents constantly interject. So a lot of times, I when I walk in the room, I address my child first. I try to get on their level and establish a rapport with them first because over everything, the child needs to be completely comfortable.
right.
And then you make the parent a part of that process by talking to the parent as well, during that. But I don't mind parents in the back. I actually think they help a lot of times as long as kind of some boundaries or some rules are established from get go. But I feel like as a parent, I know I want to see my child's doctors engaging with them. So that's what's the most important, for me.
Well, and I didn't mention that at the top of the show, but if you're still with us, and thank you all, I got another question from the audience, is that February is National Child Mental Health Month, awareness month. And so that's why we're doing this program to make you aware. And then, but dental health is 365 days a year, it's 7 days a week, it's every day. But we're just highlighting this month as awareness. There are some disparities in terms of I've heard some of the horror stories in terms of like um, the way they treat black children sometimes if they have a carie or cavity, and they say just pull the tooth, and that's not the way it is. There's other things that can be done, and so please, I mean, I'm not a fan of crying, race every time there's a problem, but it could be a factor. And when you look at some of the numbers, there is an obvious difference in terms of how black children are treated uh, versus others. And so, if you can't find a dentist of color, um, just follow the advice of Dr. Russell, Dr. Williams, talking about make sure that watch how they treat you from the beginning, how the staff treats you when you walk into the office, and then how the actual practitioner engages with you when you're there. Um, don't be overly sensitive, but do be aware of what's going on and make some decisions. And again, you can always find another dentist. You don't have to be stuck in a situation that's uncomfortable or untenable for you. Question from the audience is Cough on the vet is saying, why do some kids need several caps on their teeth? And is it necessary?
In some cases, it is necessary when the tooth is has a cavity that's excessively large, or if it involves the pulp, which is the area where the nerves and blood vessels are. So if your child needs more extensive treatment, then a cap or full coverage of the tooth is necessary in order to save the tooth. You always want to try to save the tooth first and foremost because the baby tooth acts as a natural space maintainer for the adult tooth that comes underneath it. So if you start extracting or pulling teeth prematurely, then you can have a whole other host of issues that you're running into as your child gets a little bit older, in terms of spacing, orthodontic issues. And if you want to try to reduce the potential need for braces down the line, you definitely don't want to start pulling teeth early. Um, Maintaining the space is going to be extremely important. Now, in some areas, a silver cap is not the only option. So myself in particular, I do zirconia crowns and silver crowns. A zirconia crown is basically a white crown for children, or a preformed white crown for children. Everybody is not a candidate for it. It depends on the nature of the tooth. It depends on how much tooth structure is left. But in the Miss Yvette, in the case that maybe you bring your child to the dentist and they say that they need a silver cap, ask them if they have that other option. Um, like I said, some pediatric dentists throughout the country do white crowns as well, so they should have that as an option as well.
Yeah, that was it. That was another comment that said some of them offer porcelain as well. Uh,
Hmm.
so you ask for these other options and to see, because I know typically, based on your plan, some options have another price tag on top of that. So
Yes.
you always have to make sure that's what it is. But that's also why a lot of times you see they go with the easiest option of pulling the tooth. But if you just learn from Dr. Russell, that's not always the best thing of pulling that tooth, because that can have
Mhm.
a longer term implication for the child as they age. And so if that's the first option, oh, we just need to pull our tooth, and carry, like, okay, well, what are my other options? That is the first question that should come out of your mouth. They're talking about pulling a child's tooth. What are my other options besides, is there the opportunity to save this tooth? And that's not you pushing back, that's you standing up and doing what you need to do to
Right.
advocate for the child and their dental health. So I'm a big fan of that as well. As we're wrapping up here, this has been a fantastic discussion. So I'm going to go around the room and y'all kind of give your final thoughts. What do you want people, the question is, what do you want people to remember the most about this conversation when it comes to their dental health, and particularly their child's dental health? We'll start with you, Dr. Russell.
I want everybody to know that it's super important to establish care early, establish a dental home by age 1, starting those good hygiene practices early, um, with the brushing, flossing. Make sure we're using a fluoridated toothpaste or fluoride toothpaste, and only using a smear amount between age 0 and 3. Once the child hits 3, you can increase the amount to a pea size amount. But consistency is key, and making sure that you are going to or bringing your child to appointments every 6 months. And sometimes there'll be a need for increased frequency of visits, but having that relationship with the dental office is the most important thing, because then you guys can set your child up for success um, in the future.
Dr. Williams.
Especially when it comes to children, especially, I know people don't think about this, but make sure your dentist is checking, especially your young girls and your young boys, for localized aggressive periodontitis. So make sure that they're probing, checking the bone levels around their molars, their first molars, and their anterior teeth, top and bottom. Because if we're able to catch that early, then your children won't end up having to see somebody like me in the future, and then having to get a lot of teeth replaced. That's the biggest thing for the periodontal aspect when it comes to children.
And Dr. Brown.
I would definitely say, listen to these doctors. They know exactly what they're talking about. You definitely want to see a pediatric dentist. And certainly really look at what your child is not only eating, but also really what they're drinking. Water, water, water. It's certainly safe starting at 6 months. And juice, really, we don't recommend, again, under a year. And then after that, very limited, only 4 ounces max in a day, if that. So really starting your children off in terms of being, good water drinkers and modeling that for them is absolutely crucial.
Absolutely. Well, I want to thank you all for giving us this hour of your time to give us some great information with regards to children's dental health. I want to thank the audience for hanging out, the great questions that you all asked, for being part of it. I would just say, I will echo what Dr. Brown is saying, as a parent, mirror, model good behavior for your child. So, especially if they're younger, brush teeth together and make it fun. We're going to, you got to change the narrative around dentistry. like Dr. Williams talked about, it's not a punishment, right? It is really something that we should model in terms of healthy habits that they can continue on through their adult life. Because again, once you get those permanent teeth, that's it. You got, and they're gonna stay with you as long as you take care of them. They're gonna take care of you. So really, really pay attention to that. Just like your eyes, you only got one set of eyes. You really got one set of teeth. Do your best to take care of what you need to do with that. And just want to thank. Look, I'm about to go cry because Dr. Williams got me all. She got me messed up right now. So I'm gonna have a little cry, but I'll be okay. I'll be okay. You'll be all right in the morning.
You'll be fine.
Yeah, right. Thank you all for joining us, and we'll see y'all next time.
Take care.
All right. Thank you.
Thanks, everybody.